talked about people's life, but you can also talk about education. We know that the denial of access to healthcare services for children who have an unqualified right to basic healthcare services, something that we often forget, that there's no talk for children of progressive realization, available resources. Children have a right to basic healthcare services. We know that the denial of that right impacts on educational outcomes. When children can't hear, or they can't see properly, or they have undiagnosed learning problems amongst children. So it's a critical right to our democracy, to our transformation. It's also a critical right when it comes to equality and inequality. As we're talking today, there's about to be a report launched in a few minutes' time looking at the private healthcare market in South Africa and how that intensifies the inequality in our country. But I suggest that as we have this discussion today about right to strike and right to protest, and what happens sometimes when right to strike and right to protest undermines access to healthcare services, that one of the things that it also does is that it intensifies inequality. Because when people no longer have a healthcare service, then they are incapacitated in a whole number of ways. And that is why I hope that we will find each other concretely in the course of this discussion. And that is why our Constitution says that everyone has a right of access to healthcare services, reflecting the Constitution of the World Health Organization, and so on and so on. And it's also why we understand here today that to deny anyone access to healthcare services is unlawful. Whatever the cause is unlawful and is a violation of rights.